Okay, so welcome to today's webinar, which is on meaningful connection during an outbreak situation. And this is part of a series of webinars that we've been doing as part of the Visiting Meaningful Connection in Anne's Law project. And we'll share details of how you can watch our other webinars at the end of the webinar. We'll share the link to the Care Inspectorate's website, where we've got a dedicated space, and I would encourage you to look at them and share them with your colleagues. So just general bit of housekeeping at the start. All your mics and your cameras have been disabled. We find it's easier, it helps prevent distraction for our participants, but please use the chat if you want to add a comment or ask any questions. So using your phones, if you've got a smartphone, you can open up the camera app, and then you just hold your phone and you scan over the camera app, over the QR code, and it'll bring you to a little yellow link. You should be able to tap on that and it'll take you to the AHA slides where you can be involved in the interactive session. We'll have got a word cloud. We've got an opportunity for you to share your information. If you're not familiar with the QR code, please use the chat. We want everyone to be involved. We also have an evaluation form, which we're going to pop into the chat. And if you can fill that in, that would be really helpful. And we would like to just welcome you all to this webinar. And we'll arrange for the recording to be made available on our website, and it'll be emailed you out with the links. And we're delighted to have Jackie Dennis with us today, Senior Improvement Advisor with a focus on IPC, and she's collated a really large selection of current links for guidance, and again they'll excuse me, all be emailed out to you as well. So moving on to the next slide. Okay, so what are we going to cover today? So we are focusing on meaningful connection, but thinking specifically about outbreaks, situations as we move into the winter months. So how do we ensure we're balancing people's rights during an outbreak situation? What information should be in a personal plan so that it can support all members of the team? Why is named and essential visiting important? How can we communicate well with family carers and other visitors? So thinking about some of the considerations that might support good communication. Supporting people living with dementia. Again, some considerations here, but a lot of the information in that section will be relevant to anybody with cognitive issues or possibly a learning disability. A lot of transferable information. And how do we use current guidance over the pandemic? We've been inundated with guidance and changes and updates. So how can we use the current guidance to support our decision making? And Jackie will take us through that. So just a bit of brief background. If you haven't been on one of our webinars, we do try to just bring this in. If you have, apologise. But the brief background is that the project was initially set up to support and promote the importance of all types of meaningful connection for people who live in care homes, as well as to help prepare the sector for the implementation of Anne's Law. So for people who want to know a bit more about Anne's Law and the current situation, we've put together a basic fact sheet, and we'll put a link to that in the chat as well. But in brief, it's planned legislation which has resulted from campaigning by relatives who were separated from their loved ones for long periods during the pandemic. And we know from research that isolation, loneliness, and these can have a profound negative consequence for people's physical, mental, and emotional health and well-being. And what we also know from research is that many people who live in care homes do experience moderate to severe loneliness, and we'll signpost you to the literature review if you want to find out a bit more information about that. So the purpose of Anne's Law is to strengthen people's rights, to have contact with those who are important to them, even during an infectious disease outbreak. While the legislation isn't there just yet, it's part of the National Care Service Bill. In the meantime, we've got 2 new health and social care standards which have been introduced to support people to stay connected, 5.16 and 5.17. And there's information again on our website and in other webinars if you want to find out a bit more about that. And we'll look at these standards a bit later in the webinar as well. So moving on to our first word cloud, what we want to do is just as a kind of refresher, just to get us thinking and just get us familiar with using the AHA slides. So on your device, if you can say, why is it important to stay connected? And what I'll do is I'll pop the QR code up here, which I've just then moved that off. Present. I'm sure we couldn't get.
Barbara, I've got the QR code pinned in the chat as well. So
Oh, brilliant.
if people scroll up to the top of the chart, they should be able to scan it there.
Okay, brilliant. So we've got that there. So people using your smartphones, let's see what's going to come up. So, yep, to support our well-being. Yep, so lots of things coming in here. So it's important that we connect with others for our well-being, our mental health, helps people feel less anxious. Positive mental health, yeah, to remain calm in a crisis, avoid loneliness, for engagement, to support our memory, can impact dementia and depression. Yep, so lots of things coming in here. I think that just emphasises a lot of the key points that we've been focusing on over the last year. So lots of really good information there.
Yeah, well-being coming through very strongly there, and mental health as well. Anxiety being mentioned quite a bit. Yeah, avoid loneliness.
Yep.
Yeah.
Okay, great. Okay, so you can keep contributing, but what we'll do now is we'll move on to the next slide, and I'll pass over to my colleague Sherry Kerr, who will take us on through the next part of the webinar.
Yeah, thanks, Barbara. Hi, everybody. So what do we mean by human rights? Obviously, this is a huge subject, and we've only time to touch on it very briefly here. Human rights are the basic rights and freedoms which belong to everybody. They're based around the principles of respect for the fundamental dignity, equality, and autonomy of all people, which, of course, are also at the heart of good care. They provide protection for the most vulnerable in our communities, which obviously includes many people who live in care homes. How can we ensure that we're balancing people's rights during an outbreak situation? So the pandemic, of course, generated some really difficult dilemmas at all levels of decision making around balancing, reducing the risk of infection and protecting the right to life against upholding people's right to a private and family life. And I think we can all recognise how challenging this was for services in trying to support people safely and balance their rights while dealing with frequently changing guidance, staffing issues, and so on. The COPPA review, which is looking at a root cause analysis of COVID-19 related deaths in care homes, also added additional pressures and fear, especially for care home managers. Article 8 of the Human Rights Act includes the right to maintain close personal ties with people who are important to you. And of course, that's particularly relevant in situations where there are restrictions on contact. It is a qualified right, which means it can be limited by public authorities in certain circumstances, as we've seen, but any restrictions must be proportionate, necessary, non-discriminatory and lawful, and must be for the minimum necessary time. The health and social care standards are underpinned by human rights, and the two new standards, that's 5.16 and 5.17, which were introduced in March 2022, support services by setting out that clear expectation that everybody who lives in a care home will always have the right to see and get support from the people who are important to them. And this includes in an outbreak situation, even when restrictions are needed to limit the spread of infection. And the principles which underlie the human rights-based approach, which we've got up there on this slide, are known as the panel principles, and that stands for participation, accountability, non-discrimination, empowerment and legality. And thinking about these can provide a good starting point for making human rights-based decisions. Our previous webinar about a human rights-based approach to meaningful connection does go into a lot more detail about this, and that is available to watch. And we'll put a link to that and to the accompanying fact sheet in the chat. I will do that just now.
Okay, great. So we're going to move now on to Jackie Dennis. So welcome, Jackie.
Good afternoon, everybody. For those of you who don't know me, like Barbara was saying, I'm Jackie Dennis. I'm the Senior Improvement Advisor, and I have a focus in IPC. It's just part of my role. But this session that I'm going to cover isn't really about telling Granny how to suck eggs. Absolutely not. It's just a wee refresher. As you know, there's been a lot of changes to the guidance over the last couple of weeks. But for me, as we're moving into sort of winter, it's really important, again, that you kind of refresh your memory, you go back through the guidance, have a wee look, while having a think about all the things that Barbara and Sherry have been covering today around that balance that needs to be struck. So if you don't mind, I'll also put my camera off just now. I know that's not really usually what happens. It's just I'm having some network issues and I'd rather not get kicked out of the session. So if you don't mind, I'll just pop this off just now and then I'll come back in at the end. So I've been asked to cover, like, just to refresh your memory about essential visits and name visitors. So again, for me, as I said to you before, this isn't about going over all ground per se, but it's just to refresh our memory. And as you know, there's multiple layers of protection now available, both to staff and to people using services. But there are times when still your health protection teams may advise, you know, for a limited period of time or as advised by them, that the service may have to restrict some access. So when we talk about essential visits, we're actually talking about, you know, this is a sort of minimum position. Even during an outbreak situation, you know, if you look at the guidance, it still talks about having 3 people that, you know, a service user or a person experiencing care can nominate, and they can visit, one person can visit every day and spend time with that person during an outbreak situation. The sort of basis for that is they still need to comply with any IPC advice that is put in the service and be able to comply with it reliably. Because even though you're accessing the service during an outbreak, there is that wider public health message that needs to be considered. And again, it's to help you so that you don't take things from the service and ultimately you don't take things into the service as well. So again, essential visits is a sort of like minimal position during an outbreak situation. The named visitor is the 3 visits, the 3 named people per day, or the 3 named people, I should say, and one per day that can access the service. So I'm not going to labour the point. The guidance is really clear. And again, it was updated there at the end of August. And remember, service users and people experiencing care have different needs and preferences for their visiting or who they want to visit. So some may not wish visitors at all during an outbreak, and this should be respected. And again, it's their needs and preferences, and that should be recorded in their personal plan as well. And it's that level of detail that really takes a lot of angst out if an outbreak situation occurs. And the bottom line is just to be outbreak ready, like I've said to you before, and it's the degree of risk for everyone, and the focus should always be on reducing risk while supporting wherever possible people to stay connected. And that's what it's all about today, is balancing that between the infection risk versus ensuring that people remain connected with people that are important to them. Next slide, please, Barbara. So what do we mean by reducing the risk of? I mean, it's really important, like I've said earlier, that we refresh all our staff memories and what the guidance is, particularly ancillary staff, your housekeeping staff. So again, that they're absolutely clear that if there is a need to ramp up or move back to transmission-based precautions, then they are fully briefed in what that is required of them. And that includes both staff who are providing direct care and those that are supporting in the background. I can't stress enough that standard infection prevention and control precautions needs to be the absolute, it should be embedded in everybody's practice every single day. It's not something that you do because you think that you should be doing it. It's something that it's everyday practice now. So again, I'm not going to labour the point, but it's worthwhile using your quality assurance processes just to make sure, you know, that the standards within your care service are being maintained. And again, it's about being vigilant. You know your residents better than anybody, and the people using your service. It's about being vigilant and acting quickly to take the necessary precautions early on to contain the spread. And ultimately, you're aiming to break the chain. So again, it's useful if you refresh your memory and break the chain of infection, because there's 6 clear steps or 6 clear points where every member or everybody that has any contact with people living in care homes can actually take or make a big difference to reducing the risk and breaking the chain. Hand hygiene, again, is absolutely crucial. Again, if you take anything away from today, it's about making sure people know how to wash their hands properly and they do it reliably, particularly in between various contacts or, you know, if they're following any procedure. Another thing is about your environmental cleanliness. Everybody has a role to play in this. It's not just your housekeeping staff, domestic staff. Everybody has a role in ensuring that the environment is kept clean, while balancing the fact that it's not a clinical area. So we always aim for the clean but not clinical approach. And the other thing is using your PPE appropriately. And I have to say, okay, what does that mean by appropriately? It's about reliably using PPE and using the correct PPE, you know, depending on the pathogen or the bug that is presented. Other things you might want to consider, next slide please, Barbara, is around ventilation. Again, natural ventilation is best, but again, you know your service users, you'll know the environment that people are living in. And although we're going into the winter, it's not always appropriate to have your windows fully opened and you know, older people are sitting there frozen. It's about balancing that risk and using your ventilation appropriately. Also, we all have to take ownership of having that kind of knowledge around if we're feeling unwell, that we don't go into services, and that includes for visitors and staff. So avoid entering the service if you have symptoms. You know, it's about reducing the risk of, again, taking things into the care home, but it's also, if there happens to be, if you're feeling unwell, we all have that ownership to make sure we do the right thing, and that whole wider public protection approach. Can't stress enough about keeping up to date with the most up-to-date guidance. RHI have updated the respiratory screening questions, so again, it's worth your while refreshing your memory in that. They're my kind of go-to areas. Personally, I'll use Public Health Scotland, and I'll also dip in and out of the RHI website. And also it's about promoting that catch it, kill it, bin it message. I know it's a bit outdated and people maybe think, oh, it's maybe not as appropriate as it used to be or whatever, but it's still as relevant today as it was when it first came out. So again, it's about calling your colleagues out or other people out if you're seeing things that practice that is not compliant with what is good practice, and it's not always what you say, but it's how you say it, and there's ways to do that. So again, back to that being vigilant, it's really important, like as social care professionals or people visiting the service, that when we see things that aren't quite right, that we actually call it out. And again, Barbara mentioned earlier about having recording things in personal plans. It's about knowing what that individual preference is. So again, they might, your relatives and your people using services, well, you know, they'll have that discussion, and it's about recording it, about what they want to happen should an outbreak occur, because again, it's their choice, and you as social care professionals are there to support that and support that decision making. And finally, it's about remembering your hierarchy of controls around, you know, either eliminating it or putting in workarounds. but the focus must always be in reducing risk, but in, you know, managing that kind of keeping people connected is the best way of describing it. So your hierarchy of controls is a really good thought process to take yourself through when you're faced with, you know, if you happen to have an outbreak declared, then it's working through that to see how you can eliminate the risk or reduce the risk going forward. And again, that will help break the chain, it will help manage people's expectations, and it will also help you communicate with families as well around why you're doing things. And it's always that focus on balancing the risk versus access to the service. Next slide, please, Barbara. So what's the new normal? This is the sort of environment that we're living in. So the things that you'll be considering using the hierarchy of controls, using the guidance to help inform your decision making, listening to what your health protection teams are advising you. It's about, you know, what do you need to consider to always reduce that risk? So the things that we've always covered, like I said, if you take away anything today, it's about washing hands, keeping your environment clean and being outbreak ready. And that's the best way that I can honestly put it across to you. It's about back to that being vigilant and being responsible for your own actions as well. The other thing you might want to consider is, you know, having some standard information available should that, you know, an outbreak in your service happen. It's about making sure that relatives are communicated in a very timely manner. It's also about sharing with them the kind of things that you're doing to reduce the risk. And again, it's good to refresh the memory on essential and name visiting. So like I said before, the essential visiting is, you know, the minimum that should happen during an outbreak situation. It is a bit more restrictive than name visiting, but again, it's usually in exceptional circumstances. You know, if a health protection team takes you to the next level, they're doing it because the risk is higher or there's a risk of, you know, maybe no compliance within the service, or, you know, that the pathogen that is presenting is you know, giving them serious concerns. So there may be times, you know, where there is a higher restrictive practice put in your service. So it's just about making sure you communicate that with your families and why it's happening, and that will help again alleviate some of the anxiety, while at the same time you're looking at creative ways in keeping people connected. So it's not good enough just to put out a message on Facebook or put a poster on your service door telling folk, oh, we've got an outbreak and, you know, we're restricting access. It's really important that you know, you really engage with families during this time and use whatever. You can use various mediums, but again, it's the message that you're putting across and giving families assurance. You know, it will be for the shortest time while you're taking your guidance from your health protection teams. And each situation will be done in its own merit and it will be based on risk. Next slide, please, Barbara. So that's useful sites. The A to Z of pathogens is really useful. Your appendices that are part of your care home IPC manual, I still refer back to them because I always like just to check in, you know, from a guidance point of view. The screening questions, like I've highlighted, the Public Health Scotland guidance, you know, the changes have all happened there at the end of August, so it's really important that these, and I'm sure you've already done it, like I said, I'm not trying to tell Granny how to suck eggs, but it's really important that these are reiterated and shared, you know, and keep revisiting them all through the winter, keep revisiting them. You know, if you're unlucky enough to have an outbreak, it is always good to revisit these things, you know, as part of your learning after an outbreak situation. Next slide, please, Barbara.
Okay, I think that's us.
Is that us? So that was just a really quick canter through. Like I said before, it's really just a wee refresher. There's nothing there that you are not already doing. There's nothing there that will be new to you. But the key message from today is getting that balance right while you're managing an outbreak situation, which is really complex and can be really challenging. And know who to go to for advice, because your health protection teams are fantastic and they will help you as much as they possibly can and help inform your decision making as well.
Yeah, great, thank you. And Jackie's going to be staying on with us and be involved in the discussion later on. So before we move on to the next bit of information, we want to just use the QR code and again onto your AHA slides, and just thinking about getting us thinking, how can people stay connected during an outbreak? So you've got some things coming on now. Named visitors, yep. The portals, calls, technology, FaceTime through iPads, lots of IT things, visits, yep, absolutely. Yep, essential visiting along with a mixture of Zoom, yep, and there can be, although we've got the 3 named visitors with one person visiting on a day, some people have got a larger network of people, and it's important that we support those connections as well.
Barbara could come in there. The other thing
Yep.
about the name, the essential visiting, there can be 2 if it's another older person that's being supported. So again, it's about knowing what the guidance is telling you, and again helping to inform your decision making. So that you do reduce a lot of anxiety if you share and support those kind of things when you're in that outbreak situation.
Yep, definitely, and having these conversations before, and I think what you were saying, it's about being outbreak ready, so having this information recorded, particularly if you're staff off, how can agency staff access it? So lots of stuff coming up here, and then we'll keep going. Can see people still typing, and then we'll move over to Sherry. She'll take us through about communication in a bit more detail. Alexa, yep. Oh, and my Alexa just came on saying she wasn't sure about that. So, oh.
See, somebody's got in their awareness of those who have no one as well. So I think that's also something that's really important to consider. Not everybody is able to have visitors.
Yep. No, that's a really good point.
Yeah.
Okay, so do you want to take us on to the next part?
Yeah, thanks, Barbara. So just thinking about, hang on, just turn on my camera there. Right, so just thinking about communication, and we have touched on this already, and it's nothing that people don't already know, but just as a quick run-through reminder, so to ensure that people's preferences are recorded for how they want to be given important information. Email might be easiest, and that might be fine for most people, but not everybody is comfortable using email. Even if they have an email address recorded, they might hardly ever look at it. And as Jackie said, you can't rely on people looking at a Facebook page or, putting a poster up on the door. So just knowing about how people want to be informed and making sure that information is recorded. Keep people informed at an early stage of a suspected outbreak. Make sure that people know what the situation is, what this means in practice for them and for their relative, that they know which areas of the home are affected, if that's applicable, and that they know when the situation will be reviewed. Just ensuring that people know what they can do, how and when, that people know about named and essential visitors, what that means, that they have relevant information about visiting arrangements during an outbreak, the use of PPE and so on. Just make sure that people have the opportunity to ask questions and to clarify anything that they don't understand. Make sure that people have got regular updates on progress. They're clearly informed about when the situation is going to be reviewed and how they will be informed about any changes. And just ensuring that family carers have enough information about the well-being of their relative, trying to provide some detail about how someone is, not just saying that they're fine. People will likely be anxious if they're not visiting us regularly. For instance, if they're one of 3 named visitors and they've been used to visiting every day, but they're not able to do that. So I suppose it's just about explaining what's been happening, how the person has been, have they been eating something that they particularly love or watching something that they enjoy on TV. Personalising the information that we give that can help to reduce anxiety and provide reassurance that staff know people well. And considering previous trauma responses. Some people might have strong reactions or fears around being informed about an outbreak based on their past experiences or anxieties or impressions that they may have from the media and so on. And this can create a trauma response for people if this is a trigger for them. So just trying to ensure that information is communicated clearly, transparently and understandably, that it's jargon-free, realistic, and doesn't assume that people have knowledge or perspective on the situation, which they might not actually have. And some people will need more reassurance than others. So I guess just about trying to recognise why some people will need that additional support. And again, just giving them that opportunity to ask questions or to ask for clarification if they need it. Remember that, as we've already mentioned, that you can consider an essential visit if that's needed and part of someone's personal plan in addition to the named visitor scheme. And that could be to alleviate stress and distress for the residents or for the relative. Okay, so just moving on to the next slide, Barbara, which is around concerns. Over to you.
Great,
Barbara.
thank you.
Yeah.
Okay, so what can people do if visiting appears to have restrictions? So in normal circumstances, there should be no limitations around the number, frequency, or length of visits. If people are not clear about what they can or they can't do, or if they've got concerns that inappropriate restrictions are in place, it's good just to remind people that they can speak to the care home manager or another senior staff member if the manager's unavailable in the first instance. We would always try and recommend that you do manage these at the care home level. But also ask about the reasons for any restrictions which are in place, how long this is likely to be for, and when this will be reviewed, as Sherry has highlighted earlier. And if this is, if you're still not satisfied, people can make a complaint through the provider's complaints process, which would be looked at internally. But also looking at the Care Inspectorate website, which we'll put a link to. And there's information there for providers and for people experiencing care and their families and friends, and helps to kind of guide them and prompt them if people feel that there's unnecessary restrictions and what that means for people. And also consider calling the Care Inspectorate Contact Centre for advice if there are still ongoing concerns which have not been resolved. We can assist and assess how best these can be dealt with according to the situation, and we can address it with the service as appropriate. Sometimes it can just be a conversation or signposting a service to the correct guidance. It's not always necessary that you have to make a complaint, although you can do that through the website as well. And also signposting people to our poster, which was designed with a kind of human rights approach that people should be able to see and receive visitors as in their own homes. And Sherry's going to take us over now with some considerations about dementia care.
Yeah, thanks, Barbara. So we're just quickly going to talk about some considerations around supporting people living with dementia or cognitive impairments of any kind, although some of this might also apply to other people. And again, it's things that people will already know, but just as a quick refresher. So thinking about purposeful walking, people who are living with dementia, for instance, will often not understand why they're expected to remain in their room. There are many reasons why someone might be walking with purpose: to fulfill a need of some kind, such as looking for someone or something, feeling lonely, feeling bored, feeling hungry or thirsty, needing the toilet, or simply being in the habit of frequent walking. So it's important that staff have the information that they need to support people in ways that are person-centred and that respect their human rights, as well as considering their safety and that of others. So again, there's that need for clear information to be recorded in the personal plan about what people's individual needs are and what strategies would be best to support them. there are likely to be increased risks if someone is unable to isolate. So there needs to be a detailed person-centered risk assessment and risk management plan, looking at how can the risks be minimized. For instance, are there any ways in which the environment can be managed, such as by sectioning off areas to provide safer walking spaces while minimizing the risk of cross-infection, increasing ventilation, providing hand washing prompts, enabling people to spend time outside wherever possible, and so on. If people are prevented from moving around freely in the way that they usually would, they may well experience stress and distress, which can itself put them at additional risk. And this, again, should be considered in their individual risk assessments. How can stress and distress be alleviated? Such as by providing meaningful person-centered activities which can be carried out safely, either alone or with distancing in place. Going outside for a regular walk, for instance, and obviously supporting named or essential visiting, or contacting loved ones remotely, where this might alleviate stress and distress. With regard to communication and the use of PPE, as we know, the use of face masks in particular can make communication very difficult, especially for people with cognitive and or communication issues, and can cause distress and anxiety for people. And again, this should be considered in the personal plan so that staff can use person-centered strategies for dealing with that. Verbal communication obviously is more muffled when wearing a face covering, and non-verbal communication via facial expression is largely hidden. It's also just harder to recognise people. I'm really bad at recognising faces anyway, and I've failed to recognise my daughter on one occasion in a shop when she was wearing a face mask, so that was a bit awkward. It can be helpful to ensure the environment is quiet and well lit and that the speaker is positioned to be clearly visible. Speaking a bit more loudly and articulating clearly can also help, as can just slowing down the rate of speech. The use of gestures and body language can be a good way of supplementing verbal communication as well. And research has found that the use of kind of meaningful, easily understandable gestures that we all know, such as thumbs up or down, or miming a drink, for instance, can be really beneficial when people have language comprehension issues. And visual supports like written words or pictures obviously can also help to supplement communication, and things like using clear name tags or even name tags with photographs on that can also be helpful. There is Scottish Government guidance on supporting people with dementia or cognitive impairment during periods of isolation, and we'll put a link to that in the chat as well for anybody who hasn't seen it. Okay, and I think over to you, Barbara, for the next slide.
Yeah, thank you. Yeah, so personal planning, we do try and focus a bit on that in all of our webinars. So what information should be in a personal plan? So we've mentioned a number of times during this webinar is about the named persons, up to 3. And yeah, somebody's reminded us in the chat that it's good if, say, if somebody's going on holiday, that name can be changed. So again, it should be clearly documented in people's notes, along with any preferences they have for communication. And a relative, may be an older person with increased frailty, so it might be that they don't want to receive a phone call during the night. So we have to think sensitively about how information is passed on if we're updating people as well. So again, the information about cognitive issues, about sensory impairments, about stress and distress, which Sherry's highlighted, the information should be person-centred and appropriate. And what support do people experiencing care need to help them with any of these barriers to communication? So do they need help with choosing the right glasses, or with supporting them with their hearing aids, changing their batteries? Things like that can really make a significant difference. And are there any specific strategies that can be put in place to help prevent any stress and distress? Could be playing their favourite music, or popping in more frequently to let them know something important is happening, or reminding them that they're not alone. Also considering people's choices, wishes, and how any preferences they have can be supported to create opportunities to connect. An example could be taking a few more minutes when attending to something like taking a meal in or providing a drink, and taking just a few moments to chat and to share some information can help and encourage people. And I know these things seem quite simple and, and they can often be overlooked when we're very busy, but just being purposeful and intentional and, making sure that, we're taking these opportunities. And again, they're quite simple, but being mindful of these when people are busy can really help people to relax. So the person-centered use of communication technology, again, considering people's preferences and abilities and the support that they need. Video calls are great for some people, but not right for everyone and can cause increased confusion or distress. And for some people, more familiar or old-fashioned methods like phone calls or letters are more appropriate for other people. So consider what aids might be used to support someone to make the best use of technology. Do they need a headset to enable them to hear better? Do they need an amplifier for their hearing aid? So how can people be supported to communicate privately with their loved ones if that's what they prefer? Again, that can be considered if people need support. But what's the best way that people can have that private conversation with their loved ones? And again, just a reminder that the right to private communication, when that's what people want, is a key human right under Article 8. And I think what might be quite helpful is that we're going to move on to some practice dilemmas and questions, which we'll all be involved in. And we've got Jackie Dennis here with us. And I thought it might be worth, Sherry, if we just have a wee conversation about window visits. There's quite a lot of things coming into the chat. So again, we do realise how distressing window visits have been during the pandemic, and they certainly wouldn't be, what for some people they're just not appropriate. But we have got some nice experiences as well. I'm just thinking back to the last webinar that we did when people were bringing, school came and they sang, and not so much in a kind of one-to-one with a personal visit, but schools came and sang, and we know that people have come if they've been married, coming outside and seeing people. But window visits again can be very distressing, and certainly wouldn't be kind of standard practice or what we would recommend, but I suppose can be used in exceptional circumstances, just being mindful of that person-centered approach. I don't know if you want to come in there, Shenny.
Yeah, nothing to add there really. I think we wouldn't be expecting window visits to be being used routinely or very much at all, at this stage, because we do have the named visitors and the essential visitors. Yeah, I mean, I don't know if Jackie wants to come in on this, but as you say, I think it would only be in exceptional circumstances really that might be happening at this point.
I think if from my perspective, if you know that the window visits is having a negative impact on the person, and you can get that the person is still having contact with others, then to me that would be something that I think you would be saying, if whoever it is it's appearing at the window, like we're in this outbreak situation, but, and I appreciate you, like you want to be here, but however this is the impact it's having, and there's the family member or the person receiving care is in contact with whoever, because I wouldn't like to think I was visiting somebody and it was causing them any stress or distress, because again that kind of defeats the purpose, doesn't it, really? Again, it's not what you say, it's how you say it and how you put it across to the nearest and dearest sort of thing.
Yeah, and I think that when that was the only thing that people could do, but it certainly
but
is.
We've moved on. It's like we have moved on a lot. So yeah, I wouldn't be expecting that. And I think, like I said, if it was having more of a negative impact, then me as a person would be reflecting in that, I think, or it should be, because the focus needs to be in the person, doesn't it?
Yeah, just having those conversations with people about, you know, what's actually a benefit and what's maybe actually just causing more, you know, more distress. Yeah.
Yeah, great. So I think if we can use the chat, or you can use the AHA slides if you've got any practice dilemmas or questions, or if you want anything clarified, we have got the time. Also, I'm just looking in the chat. Some people have also said that using talking mats for communication can be quite good. I'm just kind of flicking back as well. Lots of links there. Okay, so we've got someone putting up here, scrutiny from peers in health who do not routinely visit, follow guidance, but attend after an outbreak and scrutinise once. Supporting the care home. Again, care home has absorbed their role also during restrictions. So I think, you know, yeah, do you want to come in there, Jackie?
I'm not sure what it's actually saying, Barbara. Is it just meaning?
I think it's more just a comment that I think maybe the stress, additional stress caused by scrutiny from peers. And I think, you know, obviously with the changing guidance and different expectations, but, you know, the guidance is routinely updated. And again, using our own, the processes within the quality framework, that should always be, you know, where you're going, using the guidance. And again, I suppose just having these supportive conversations. And if you feel that something is not, you know, if there has been things that you don't agree with, you know, have the conversations, you know, speak to your lead inspector as well. Sometimes it's just about that shared learning and shared conversation as well.
The thing I forgot to say, although we're moving into winter and a lot of it's to do with respiratory, you just need to be ready for any outbreak situation. And like you said there, it's about the guidance and the A to Z of pathogens. I can't stress that enough. It's part of your IPC manual that you get online. There's a wealth of information in there as well to help you, you know, if you suspect something, as well as having your conversations with your local contacts. That will help you, you know, initially, and then as you're moving forward. So like you said, Barbara, just knowing the guidance and you know, using
speaking
it
to
appropriately.
People. Speaking to people. So we've got a question here, and this is is it ever acceptable to implement a strict no visitor policy for any period of time? So this would only ever be done under direction from Public Health Scotland.
Absolutely.
And it should be for the least restrictive period of time. But again, essential visiting should be an option. But again, this would be under guidance, so it would never really be acceptable for a care home to just make that decision. It has to be under guidance of the Public Health Scotland.
Definitely.
Yeah. Okay, and Sherry's popped the evaluation form into the chat, which would be helpful. Okay, so we've got a comment here. It's such a balancing act to maintain meaningful connection. The fear of being made to feel incompetent by various peers who have very little idea of how complex life in a care home can and has left a lot of staff feeling traumatised. Yep, we absolutely appreciate that. And I think that's come through in a lot of the information that we've been looking at as part of our project. It might be encouraging to let staff read the literature review, signpost it to them. There's also a care home report that we've done from 20 visits. And then there's a report that's due to be published that we've got from feedback from staff, care home staff through the SSSC as part of our engagement. So I think it can be helpful for people to realise that they're not alone and that other people have felt like that, and there is now that recognition, across the Scottish government. This is projects funded by them, but also that we are recognising, the impact that's had on staff. So I think you might find some of these publications and the information that we have in other webinars may help to support staff, and just that appreciation of how complex it was for everybody.
Yeah, absolutely, Barbara. And I think we're really very, very acutely aware of, how difficult it has been for everyone, and how difficult that balancing act has been, against kind of trying to maintain people's connections, trying to support people against reducing the risk of infection. And it's just been it's been a horribly difficult balancing act to negotiate, and an impossible one at times. So yeah, we're very well aware of that. I'm just going to put up a link just now to our webpage, which has some of those links that you were talking about, Barbara.
Great.
Yeah.
Yep. Okay, so I've not really got any other questions coming in, but feel free that you can email us at the Anne's Law website. And we've got a comment there just come in the chat, which it says, working in partnership with care home staff, residents and relatives alongside public health and health protection teams, decision making on the shortest isolation times are important, and accountability for decisions at local level. We'd like to see more on mental health and physical well-being. Isolation can lead to delirium and loss of mobility, and it helps to ensure that residents can go out safely during outbreaks, as well as long as transparent conversations and trust. So many family caregivers are highly experienced and able. Yep, we would reiterate all of that. And I think that's the importance of the 2 new health and social care standards, which encourage people, if they want to be partners in care, that family carers should be supported to come in and help to provide that care. I think that's really crucial. And have a wealth of experience. We've also got another webinar on the importance of family carers, involving them in all aspects. So it's really important that we are including people if that's what they want, to support, particularly if there's staffing issues. We know the sector is facing, exceeding pressure with staffing and issues that, you've got amazing family carers there that want to be involved. So again, if people are not aware of the health and social care standards, it might be worth letting family carers know about them, part of your newsletter, raising awareness, have conversations with people to support with nutrition. It might be personal care, you can do things just for support, for emotional support as well. So yeah, working in partnership is crucial. So thanks for popping that on.
Yeah, definitely. And I think what you're saying there about, the physical, mental effects of isolation, I think that's something that, we've seen, research really bears that out as well, and we've seen that coming through very strongly. There's a massive body of evidence to show how profound those impacts are on people's physical, mental, and emotional health and well-being. When they have that isolation, that lack of connection. So yes, we absolutely need to make it a very high priority.
Yep. Okay, so I think we'll just end the webinar there. So I think thank you everybody for attending. And again, if you could fill in the evaluation form, we would be grateful. This, if some of our webinars and information that we've provided has actually come from your direct feedback. So we really appreciate people who have been involved and active in these sessions. Your information really adds to the wealth. I'd like to thank Jackie Dennis for coming along and for supporting the webinar. We're greatly appreciative. And again, we've got our email address there, you've got our website, so please do contact us with any comments, or if you need any support, or if you have concerns about visiting and any restrictions, please do follow the information. So the slides and the links and all the information will be sent out to you in due course. And I think we'll just stop the webinar there.
Yep, thanks very much everyone for attending, and that evaluation form is in the chat.